My name is Dr. Alexander Krakovsky. I practice cosmetic surgery in Southern California. I'd like to introduce you to one of my patients.
Well, the first time when I was looking for girth. I was looking for possibly more length. Noticed as I got older that, of course, things, shrink with age, and I was hoping to find something that would be satisfactory. My only thought was an implant. Made the appointment with the previous doctor that I had the first surgery with. When I went to his office and was having the consultation before the surgery, that he was kind of rushing me through questions or the paperwork, and even when he showed me implants, I asked to feel them and touch them to see possibly how natural they might be. At first he didn't even give them to me. I almost had to, take them out of his hand to, so I could tell. They seemed kind of natural. It seemed soft enough, it seemed pliable enough. The next day when we went in for surgery, I was actually on the table, hooked up, ready to be put to sleep before the doctor came in. And I had actually asked the anesthesiologist to wait to put me to sleep so I could ask the doctor a question, which I was actually going to change my mind on the implant, because I guess I was pretty much satisfied, but I thought I'd get more, but I really didn't like the real look and feel of what he showed me. Well, before I knew it, I was already out. And the gentleman that I guess his anesthesiologist that I was talking to, I don't believe he really understood English clearly, because I repeated it a few times. And next thing I knew, I woke up and it was all over. Immediately, I didn't like it. I mean, in the room after I was recuperating in my hotel room, looking at it, there was no natural look whatsoever. It looked deformed. It looked like it was partially erect all the time, because the implant was basically forcing my penis out instead of just relaxed. The next day when I went in to speak with him and told him about it, he says, "Oh, that will relax with time. You do this exercise, you do that exercise, and it'll help, make all that change." Well, honestly, within 3 to 4 months, it got worse. I mean, it was retracting. I could tell just because of the way the head of the penis wasn't straight. It was bent. You could see the outer edge of the implant through the skin. Plain as day, it just looked totally unnatural. I mean, there wasn't anything good about it. I'd lost 2 inches in length with erection after the implant. The head of the penis would never fill up with blood because I think there was so much pressure from the implant forcing it around the skin or the penis that I couldn't get any blood flow. I mean, I was so self-conscious I couldn't even get an erection, number one. Number two, I just didn't feel comfortable and never did anything for almost a year. I couldn't even really penetrate very well. But even then, the first relation I tried to have was just so turned off by the look, I couldn't even, there was nothing there. And I understood. I wasn't upset over it. I was more upset at the fact that, it was so unnatural. It didn't look natural. It didn't feel natural. It's like I had an erection all the time because it was so thick and hard. It wasn't natural feeling, even flaccid, So after that, I never even tried. And even, on personal level, that if I did, I never even got a full erection as far as, for masturbating or anything else. And it got to a point where the pressure on my pelvic area from it was so uncomfortable from the implant. I didn't realize how long it was that was actually in there. I knew it was up against there, but it was pushing all the time. Even when I tried to urinate, it wasn't a good flow. And if I did have any kind of ejaculation, it was like delayed, and it wasn't there right away because of the pressure. And I was afraid I was doing nerve damage by leaving it in. Number one, I didn't trust going back where I had it done the first time. I was afraid he might do more damage removing it just out of, fastness or just being in a rush. So I felt better going somewhere where they would be more you know, sensitive to the thought of what, you know, I'd been through and take more care of, you know, taking it out. So, and then I've, you know, got in contact with Dr. Krakowski, and he was very kind, considerate. His whole staff was very helpful. They were always checking to see how I was doing. Unlike before, they never called me once, never checked up on me. You can tell if you're a human being, you can tell from other people. I deal with people every day, and I could see the sincerity. Felt very comfortable. I wasn't nervous one bit going into surgery to remove it. Had zero pain, little uncomfortableness, which is you know, not unusual, but just glad to have it removed. This is actually what they had inside of me, wrapped around the shaft of my penis, and if I was lucky enough to have that much, I wouldn't have been asking for any kind of girth, or any kind of length, because who would? I'd bet only that much of it was actually my penis soft. This was all up against my pelvic area, from what I understand. This is where the skin was wrapped around the head of my penis. That thickness right there was pushing through the skin. There wasn't even enough blood flow to pump up to get penetration, basically. I could always feel this back area up against my pelvic area pushing all the time, so I was, you know, basically walking around with a semi-erection all the time. And it's very crudely cut, the way it's trimmed around the part where the base of the head of the penis was right here. And I'm surprised it didn't cause more damage if it did. The night he removed it, I had 4 natural erections, which I hadn't had in over a year. And that to me was showing at least, hopefully there wasn't as much damage as I thought there might have been, which is a big relief. I've just had the surgery not even 3 days ago, and honestly, when I first woke up, I couldn't even tell that I'd even had it, you know, any surgery whatsoever, because I had virtually no uncomfortableness of pain or of any kind. You know, wasn't able not to sleep. Really, I mean, I've been up walking around the very next day. I feel like a man again. I feel natural. It felt good. I'd like to thank Dr. Krakowski for everything, for his personal care he gave me, to removing it, to his care of post and pre-op surgery. There is a huge difference in comparison to different ways people, you know, other physicians do these things. I can tell you that firsthand. My first choice was not the right one, at least for me. I know that for a fact it was not good. I would highly recommend Dr. Krakowski for your surgeon on this type of procedure. There's no question. I'll be back to finish up the next part for sure.